Welcome to Visual Diagnosis. Let us now continue our discussion on aspects of complexion color. Lustrous or lusterless color. Observation. A lustrous complexion is bright, moist, vigorous, and shining, while a lusterless complexion is dark, dull, gloomy, and withered. It is important to note that in the context of pathology, an abnormal color may be lusterless or lustrous. The presence of luster in the complexion indicates a good prognosis, even if the color is abnormal. The brightness of the complexion is a manifestation of the spirit, while the luster derives from the nourishment of essence and blood. Clinical significance. If an abnormal complexion color is lustrous, it denotes that the spirit is not affected. Pathogenic factors are not too strong. The condition is mild. The treatment is relatively easy, and the prognosis is good. If an abnormal complexion color is lusterless, it indicates that the spirit has been affected. Pathogenic factors are relatively strong. The upright chi is very deficient. The condition is severe. The treatment is relatively difficult, and the prognosis is poor. Okay. Chapter 49 of the Spiritual Access says, observation of the luster or lack of luster of the complexion color allows us to judge whether the prognosis is good or bad. If an abnormal color of complexion acquires luster, this indicates that the condition is improving. Upright chi is returning, the spirit is recovering, and the prognosis is good. Vice versa, if an abnormal lustrous color of the complexion loses its luster, this indicates that the spirit is affected. The condition is worsening, upright chi is weakening, and the prognosis is poor. To summarize, lustrous color indicates good spirit. Pathogenic factors are not strong. Condition is mild, and the prognosis is good. Lusterless color indicates weakened spirit. Pathogenic factors are strong. Condition is severe, and the prognosis is not good. Now let's go to conforming or opposing color. Observation. The differentiation between a conforming color and an opposing color is based on two distinct aspects. The first is whether the complexion color accords with the prevailing disharmony. The second is whether the complexion color accords with the prevailing disharmony according to the 5 elements, and specifically according to the generating and overacting cycles. Now we have here a table summary of complexion color types. In superficial, it can be seen clearly in the surface of the complexion. It indicates mild condition located on the exterior and in the young organs. Deep, it appears to be a level below the surface. The condition is severe and is located in the interior or in the yin organs. Distinct, appears bright and clear, manifests itself readily. It is a young type of disease. Superficial, upright chi is not exhausted. Obscure, it appears darkish, dull, and lifeless as if trapped inside the complexion. It indicates yin type of disease. Deep upright chi is weakened. Scattered, appears thinly distributed and sparse. It is an indication of a mild disease, has short duration, pathogenic factors are not strong, and prognosis is good. Concentrated, appears densely distributed and aggregated. It is an indication of a severe disease, long duration, pathogenic factors are strong, and the prognosis is not good. With luster, it appears bright, moist, vigorous, and shining. It indicates that the spirit is not affected. Pathogenic factors are not too strong. The condition is mild. The treatment is relatively easy, and the prognosis is good. Without luster, appears dark, dull, gloomy, and withered. It indicates that the spirit has been affected. Pathogenic factors are relatively strong. The upright chi is very deficient. The condition is severe. The treatment relatively difficult, and the prognosis is poor. Now let's go to conforming or opposing color according to pattern. According to the first aspect, a conforming color is in accordance with the condition of the patient. For example, the patient has a heat pattern and the complexion is red. An opposing color contradicts the patient's prevailing pattern. For example, the patient has a clear heat pattern, but the complexion is pale. There can be several different explanations of the contradiction between the prevailing disharmony and the complexion color as follows. First, the complexion color may contradict the main disharmony simply because the patient suffers from several different patterns and the complexion reflects one of them. For example, it would not be unusual for a person to suffer from chronic spleen Qi deficiency and therefore have a dull, pale, yellowish complexion, but also to suffer from heart fire. Second, the complexion color is influenced by seasonal influences. Thus, a person may have a reddish complexion on the summer but suffer from chronic spleen Qi deficiency. Third, the complexion color strongly reflects the state of the mind and spirit, and it may occasionally contradict the prevailing pattern. For example, a person may suffer from liver fire, but if this develops from the accumulated stagnant qi deriving from deep emotional problems such as shock and guilt, the complexion may not be red, but pale, bluish, or greenish. In such cases, the complexion usually shows the deep underlying emotional cause of the disharmony. And the fourth, in rare cases, there may be a false complexion color when there is a total separation of yin and yang and the patient suffers from false yang, like red face, very cold limbs, and slow pulse, or from false yin, very pale face, feeling of heat, and rectangle. Next is conforming or opposing color according to the 5 elements. According to the second aspect, the conforming or opposing complexion color is also decided on the basis of the 5 elements, and one can distinguish 4 different situations when the complexion does not accord with the prevailing element pattern. A practical example is the best way of describing these 4 possible situations. If a patient suffers from a liver pattern, but the complexion reflects the color of the mother element, which is water, this is called conforming color. If the complexion reflects the color of the child element, which is fire, this is called the slightly opposing color. Chinese books refer to it as opposing within conformity. If the complexion reflects the color of the element overacted upon, which is earth, this is called opposing color. Chinese books refer to it as conformity within opposition. If the complexion reflects the color of the element overacting on that of the prevailing pattern, which is metal, this is called strongly opposing color. The last scenario, in which the complexion color belongs to the element that overacts in the element of the prevailing pattern, it is the most serious one. For example, if a patient suffers from a severe spleen G deficiency, but the complexion is green, this is a bad sign, and it means that the condition will be more difficult to treat. Now we have here a table of conforming and opposing complexion colors according to the 5 elements. In wood pattern, red is slightly opposing, yellow is opposing, white is strongly opposing, and dark is conforming. In fire element pattern, green is conforming, yellow is slightly opposing, white is opposing, dark is strongly opposing. In earth element pattern, green is strongly opposing, red is conforming, white is slightly opposing, and dark is opposing. In metal element pattern, green is opposing, red is strongly opposing, yellow is conforming, and dark is slightly opposing. And in water element pattern, green is slightly opposing, red is opposing, yellow is strongly opposing, white is conforming. The conforming and opposing colors for diseases of the 5 elements are illustrated clearly here. Okay, now in wood as in liver pattern, red is slightly opposing, yellow is opposing, white is strongly opposing, and dark is conforming. In fire element, as in heart pattern, yellow is slightly opposing, white is opposing, dark is strongly opposing, and green is conforming. In earth element, as in spleen pattern, red is conforming, green is strongly opposing, dark is opposing, and white is slightly opposing. In metal element, as in lung pattern, dark is slightly opposing, green is opposing, red is strongly opposing, yellow is conforming. And the last is the water element, as in kidney pattern. Green is slightly opposing, red is opposing, yellow is strongly opposing, and white is conforming. Okay? Now let's go to its clinical significance. The differentiation between a conforming or an opposing color, whether according to pattern or the 5 elements, helps us to gauge the severity of the disease, the relative strength of pathogenic factors and upright chi, and therefore the prognosis. If the complexion color conforms with a disease condition, it indicates that the disease is mild, pathogenic factors are not strong, upright chi is still relatively intact, the treatment will be relatively easy, and the prognosis is good. If the complexion color opposes the disease condition, it indicates that the disease is severe, pathogenic factors are strong, upright chi is weak, the treatment will be relatively difficult, and prognosis is bad. Of course, the conformity or opposition of the complexion color according to the 5 elements is only one of the aspects to be considered in color diagnosis. All other factors shall be taken into account, and with regard to complexion in particular, the presence or absence of luster overrides the others. In other words, if the complexion is dark, dull, and without luster, this indicates a poor prognosis even if the color is conforming. Conversely, if the complexion has luster, the prognosis is good even if the color is opposing. Okay? Thank you so much for your attention.